On behalf of the employer commissioners bargaining health benefits for Vermont public school employees, I'm going to take a few minutes to talk about getting the right care at the right price and how that can save millions of dollars without compromising health. Everyone wants to be sure that people get the health care they need, but we also want to be sure that our hard-earned dollars are getting value, that we're not paying for any claim or any service that we don't need to. One of the goals is to help reduce low-value care, and this is where school employees can partner with VHI and their employers to save money. So what is low-value care? Low-value care is duplicative, unnecessary, or higher price than needed. Avoiding low-value care will have no negative impact on health outcomes, may even improve health outcomes, and can save money. So let's talk about a couple examples. Getting an X-ray twice for the same injury, rather than having the image shared between multiple providers. Going to the emergency room when you don't have a true emergency. And in fact, the condition could better be taken care of through telemedicine, primary care provider, or an urgent care center. It's knowing what to talk to your doctor about and asking about whether or not the test will make a difference in the treatment plan. And most importantly, it's looking at prescription drugs and picking a generic drug whenever possible. And if generic is not possible, picking the preferred brand drug. This is a copy of a flyer that VHI produced in 2021, reminding school employees that generic drugs can save everyone money. A 1% shift in favor of generics for the VHI population can reduce costs between $500,000 and $750,000 a year. That means over 2 years, we're talking $1 million to $1.5 million in potential savings. The flyers that I showed you recently are all of those that were prepared by VHI and available to school employees on their website. Here's another one showing the Blue Cross Blue Shield transparency tool for medical services so that people can compare prices when that makes sense to do so. Now you may ask, does it really make sense? Can people really make these kind of comparisons? Let's take a look at the 33,000 active school employees and their dependents. About 46% of those covered by VHI in the active school population are staying healthy. Their average monthly medical cost is about $157. These people may not have as much opportunity to save money, but there's still some there. 2% of the members are in the red category. They have complex and/or catastrophic health conditions. While they drive a larger percent of medical costs, no one expects them to take time to compare prices. They need to get the care they need, getting that right care, and the cost is not relevant at that time. But the vast majority of VHI employees are in that 52% of members. Their medical cost per member per month is about $741. This is the group that we really want to target in starting to make some thoughtful decisions about how they spend their medical dollars, because that can make a difference for all of us. Now, many people say, does it really make a difference if I switch to generic, or if I reduce one X-ray, or if I go to the urgent care center instead of the emergency care center? Those are still just small dollars. How can that really add up to millions of dollars in savings? Well, remember, VHI currently covers 33,000 Vermonters, active school members and their family. If each of those individuals could save $100 a year, that's $3.3 million. VHI collects about $260 million in premium. So a savings of $3.3 million means that the premium increase could be reduced by 1.25%. So the 9.8 rate increase that we just experienced could have been an 8.5 rate increase. Now, not everyone will be able to save $100, but what if just a third of the covered lives, 11,000 people, were able to make a change to reduce their claims by $250 in a year? That's one X-ray that wasn't duplicated. That's a switch to generics. That's looking at the cost transparency tool and maybe making a decision about where you get that non-emergent MRI. That could save $2.7 million a year. Over 3 years, that is approaching $8.5 million. This could remove 3% in premium increase over the next 3 years. So there are opportunities for school employees to make small but important changes in their health care, reducing low-value care that's duplicative or unnecessary or higher price than needed, and have a future positive impact on premium increases.